Joining us now from Mauritius is the president of that country from 2015 to 2018, Ameenah Gurib-Fakim. Madam President, thanks so much for your time. Just wanted to get a sense of what really is happening in Mauritius. The latest figures we do hear are of possibly 7 deaths and about 161 people infected.
Yes, that's correct. As of this morning, these are the figures which have been communicated by the government. And probably by this afternoon, when we have further communication, I'm afraid that the numbers will go up.
Ma'am, one of the things that we've seen across the world is how asymptomatic patients are spreading the COVID-19 virus. That's something that's extremely crucial in terms of stopping the spread, to identify them.
Absolutely. I think this is something that the WHO has been mentioning all along, is that people who develop the COVID symptoms usually have an incubation time of between 5 to 7 days. And I think this is where people have to be very careful, and the governments have to ensure that testing is done. And I think just to adopt the WHO rhetoric is testing, 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 then isolating, and then you treat them. But the most dangerous part are precisely the people who actually don't show any symptoms, and yet they are carriers of this deadly virus.
So prevention, you're saying, is absolutely crucial.
Prevention is crucial because it's a virus and there is no cure, there's no vaccine, there are no medications so far. So absolute containment is the only way that we will be able to actually reduce the spreading, break the cycle, as they say in the jargon, and then prevent other people from getting infected.
So would you be in favor of strict lockdowns in India, which is an extremely vast area and number of people? The attempt is to do that, but we see even here that there are lots of cases of people, whether inadvertently or consciously, breaking that lockdown.
You're right, because countries like China, for example, have done it with the city of Wuhan. They have adopted very, very stringent measures. A country with the size of India maybe is going to be much more problematic because of the sheer size of the population. But yesterday I was reading an article which says that if you adopt some of the basic practices like wearing a mask and washing your hands very often, already you are halfway through solving the problem. But I think communication is where it matters a lot. We need to communicate systematically to people in the language they can understand. But I think providing them with the basics, provide them with food, provide them with water, make sure that they have enough soap, for example, to clean themselves, and also provide them with a basic mask, for example. These are already measures which are proving to be successful in some parts of the world.
A lot of us are deemed, like even in India, the media is called an essential service. So we are exempted from the lockdown, but even we are working from home, doing Skypes like this. So just a request, because you're talking about technology, if you could just tilt down your laptop so that I can see your face. Yeah, that's perfect. Since you're talking about technology, ma'am, if you go back in terms of what lessons we have learned and how technology has moved forward from 2005. Now, we've really, in terms of communication levels, have changed so much.
I think communication has been a very critical factor here for getting the world to know what the virus exists and what is the spread and how we are being kept abreast of the development. And as you rightly say, if this had happened in 2005, I just don't know what disaster we would have encountered. And thank goodness that we have technology. But this begs another question. What are governments doing in terms of investment in that space? Not just technology, in terms of the science, in terms of our preparedness. What are the health systems we're looking like? And I think what the virus has done, Amitabh, is that it has revealed us. It has revealed our institutions, it has revealed our leaders, and I think it has revealed society at large, where our weaknesses are. It's time for solidarity, it's time for sharing, it's time to show more preparedness because, unfortunately, as a scientist, I can say that we haven't seen the last of pandemics. We've had smaller doses of Zika. We've had Ebola, which has been limited in Africa. But this one has taken all by surprise. But I think it is a thing of what the future holds, especially as we are going through this terrible, bigger pandemic, which is climate change.
Since you're pointing out that you're a biodiversity scientist even before you became a politician and then the president, and you are coming to us from Quatre Bornes, which, if I'm correct in translating, is the city of flowers. Tell
Yes.
us a little bit more about the connect, if there is any, between, say, climate change with a country like Mauritius would really be on top of the agenda, and, say, a pandemic like COVID-19 in terms of, say, the global to local connect.
Already, I think in terms of the climate change challenges, we are an island. As you know, we will get the full blast of climate change with rising sea level, destruction of the coral reef, warming of the seas. So all these will have a big impact on our food security, for example. But because we eat a lot of fish, and so already food issue. Now, on the positive side is that because we are a small island, it may be that we should be able to contain this much better. But having said this, we are living in a global village, which the world has become by virtue of, as I said, technology and everything else. And because of that, and because of movement, I think we have seen how the lockdown for the airlines have been critical in terms of this pandemic. So, be it small, be it big, I think we're going to be impacted equally. And as you said, a country like India will suffer differently because of the size. Even being small here, we will suffer because of all the issues we have talked about. So, in this particular respect, whatever be religion, caste, class, whatever it is, we will all be impacted equally by the COVID-19.
But there is inequality in terms of the health services and how people who are affected, whether it's by the pandemic, COVID-19, or climate change, will get affected. Is that something that you share?
Absolutely. And I think already we are saying what inequality means in terms of food access, right? The poor are getting battered. Some even are quoting that we will not be killed by the COVID-19, we will be killed by hunger first. So this is highlighting something which is absolutely disaster, because to me, food is a human right. And if you talk about in terms of social measures, we have all been, all happy-go-lucky about the gig economy. Already, the gig economy is showing all the weaknesses that we can think of. No social security net. Fortunately, the founding fathers of Mauritius, they have put in place social security measures, and we know that the poor will get food, the poor, the orphans will get a pension. So this has been very, very critical. And as I said earlier in the interview, the fact that we have the pandemic, it has revealed all our weaknesses. Unfortunately, we have also seen the nasty side, the downside of inequality. And this, of course, is breeding more insecurity. And right now, we are sitting on it in the box. And I'm afraid it is going to get worse before it gets better.
In terms of the unique measures, say, that Mauritius has put in place, I was reading about how, I think, from the second, that is from today, essential supplies, when people go to the supermarkets or to the markets to buy their food and other supplies, it's based on, say, the first letter of their surname from A to, say, F, go on Mondays and Thursdays. Is that something that you see working?
This is starting today, actually, and unfortunately, it is creating a lot of chaotic situation right now as we speak on the road.
Okay.
So again, this is showing that the state of preparedness with the planning that goes behind, and again, it also brings on board something which India may not have, but many African countries, even Mauritius, have. How do we bring the competence on board? If there are any, or if there are very few, we need to bring them on board so as we all put our heads together and solve problems. India has a huge human capital, and I'm sure India has all the talents that it can have to bring to bear for problems like this. So we hope that this message will be heard across the developing world. We need to invest in our human capital. We need to ensure the state of preparedness, be it at the level of the institution, at the level of the services, but more importantly, at the level of our environment. We need to stop destroying our nature. We are part of this ecosystem. And I think what the COVID-19 has shown, even though we are the apex species, we are very much part of this nature, and we should stop destroying. And COVID has told us enough. Mother Nature will not stop the way we have been destroying our nature. And I think even in India, I've seen in the media, there are good news because the air is pure. Street, we've seen the dolphins are back in the. So it's telling us something which is very important. We are part of this ecosystem.
In the blue skies, we're seeing the stars at night, the birds are chirping, there's so
Exactly.
much less pollution. Since you mentioned India, ma'am, I'd like to end by just asking you, is there, in terms of your healthcare system or essential supplies, since there is some kind of a lockdown, I'm not certain how trade is functioning, would there be any assistance that the Mauritius could or would need from India? I do know our naval ships which have pallets of HADR, which is disaster relief material on board, make trips in and around the Mauritius and even to Port Louis.
I think right now our needs will be in terms of testing. We need the testing kits very, very urgently. And I think the other thing that we will need, of course, are, we know that India is very big in terms of generics. We'll need a lot of hydrochloroquine, for example, to actually test and treat the people in the early stages. But again, India also will have her needs. So I don't know to
Yeah.
what level we will be able to share all these. But I think for me, we will need all these as a matter of urgency.
Madam President, thank you so much for your time and please do stay safe. We do appreciate your time.
Thank you so much for having me.